Imagine a patient, maybe recovering in a hospital, they're taking a shower or, just filling their water jug. Seems perfectly normal.
Absolutely routine.
But what if those simple everyday actions were actually putting them at serious risk?
Yeah.
Welcome to the deep dive. Today, we're unpacking something quite startling. The idea that water safety in hospitals, as we usually think of it, is dangerously outdated.
It really is.
And it might be time for a pretty radical rethink.
That's exactly right.
What?
Our mission today is to really get into some crucial new research. It basically redefines how we need to approach water and wastewater systems in healthcare.
Okay.
It shows how they're uniquely intertwined, is the phrase used, and the risks, the really significant ones often being missed, they're actually coming from the wastewater side.
The wastewater side, so not the clean water coming in.
Well, yes, that too. But the wastewater part is this huge overlooked area, a major blind spot.
Okay, that's a big claim.
Yeah.
So if water safety as we know it is outdated, what exactly have we been missing? What are these blind spots?
Well, the main problem is the term water safety itself. It kind of came about when the risks from wastewater just weren't really on the radar. And because of that narrow focus, frankly, it's really held back developing the right kind of expertise, the right training.
Right.
And look, we've had warnings about this for a while. People were talking about hospital water supply as an infection source way back in 2002.
Wow, that long ago.
Yeah. And then in 2012, the idea of the wastewater system being a superhighway for germs, for pathogens, that came up. But still
no big change.
not widespread proactive ones. Mostly any action is reactive. It happens
Yeah.
after a tragic outbreak. Like the problems highlighted at the new Queen Elizabeth University Hospital in Glasgow. Big deficiencies came to light there.
So we wait for disaster before fixing things.
Too often, yes.
Mhm.
It means these critical risks are just falling through the cracks in our current systems. They go undetected until it's too late.
Okay, so those are the flaws. How are researchers suggesting we actually fix this? Is there a new way, a new framework?
Yes, and this is where it gets really interesting. They're proposing a completely new way to classify the whole plumbed-in system,
Okay.
breaking it down into 3 distinct zones, or maybe battlegrounds, each one needing its own approach, its own safeguards.
3 zones. Okay, what are they?
So first, Zone 1, you could call it, the main body of the water system. That's your incoming mains water, right up to, say, the last 2 meters of pipe before the tap or shower.
Right, the bulk's supply.
Exactly. This part keeps that traditional water safety label. But then, crucially, there's Zone 2, the periphery of the wastewater system.
The periphery, so the ends of the pipes.
Precisely. The last 2 meters of pipework, the taps themselves, shower heads, drains, those U-bends or waste traps, and the very start of the wastewater pipes.
Where people actually interact with the system.
Exactly. This is where most human interaction happens, and they're calling this clinically integrated wastewater safety.
Clinically integrated.
Okay, think about it. Someone washes their hands, a patient gets a drink. If this zone isn't managed right, it can become a direct route for those dangerous superbugs.
A kind of forgotten zone where water meets waste and patients.
You could put it like that. And that leads us to the third zone, the main body of the wastewater system.
So everything after those initial drains and traps.
Yeah, the whole drainage network inside the hospital all the way down to where it connects to the main sewer outside, this would be covered by wastewater safety.
And why is separating this out so important?
Because right now, those water safety groups in hospitals, they almost never deal with wastewater. It's just not on their agenda.
Even though it's a risk.
A major hazard. We're talking situations, really disturbing ones, where actual raw sewage has backed up and flowed out of shower drains.
What? In patient areas?
Yes, sometimes in areas with really vulnerable patients. And your standard infection control, wiping things down, it often doesn't touch these kinds of problems.
So what do you do?
Sometimes the issues are so fundamental built into the design
Sure.
that the only real solution is something drastic, like actually removing sinks entirely from certain areas.
Removing sinks. Wow, that really highlights how serious this can be.
It does. It shows that sometimes the design itself creates these traps for pathogens, and no amount of cleaning can fix it once it's built that way. It's a last resort, but it tells you the scale of the problem in some places.
This new 3-zone approach, it sounds critical for hospital managers, but what about for, the average person, for patient safety right now?
It means we really need a shift in thinking, a paradigm shift. The rise of antimicrobial resistance, AMR.
Right, the superbugs that resist antibiotics.
Exactly. That whole crisis has sort of uh, unmasked these deep problems in water systems. Why? Because these resistant bugs are often easier to trace back to a source. So suddenly, things you might do in a hospital, taking a shower, a nurse giving a bed bath, even just filling a water jug for a patient, these can become ways for serious infections to spread if the whole system, water and wastewater, isn't managed together.
So design is absolutely key, especially for new buildings.
Absolutely crucial.
Yeah.
The research really hammers this home. New facilities have to be designed from day one to minimize these risks. Trying to fix them later, retrofitting.
Expensive.
Extremely expensive and often, honestly, just impossible. Like imagine trying to change shower drains once they're embedded deep in concrete floors. You just can't.
Okay, so plumbed-in systems are a huge focus, but you mentioned things getting missed.
Uh,
Are there other ways these bugs spread beyond the pipes?
Good point. Yes. The research also flags what they call alternative sources, things not directly connected to the plumbing.
Like what?
Well, sometimes items get contaminated during manufacturing. There was a known issue with certain heater-cooler units used in cardiac bypass surgery arriving already containing dangerous bacteria.
From the factory.
Yes. Or even something as simple as maintenance tools. Think about a drain snake, a coil used to unblock a drain. If it's used in one area with contamination and then used in another patient area without perfect decontamination, you've just spread the problem.
Cross-contamination from the tools meant to fix things.
Exactly. So it's about seeing the whole picture, every potential pathway, not just the water coming out of the tap.
This deep dive really underlines it then. We need to move from just thinking water safety to a much broader, more integrated water and wastewater safety approach. That seems vital for protecting patients.
It really does. And it leaves you with a pretty important thought, doesn't it?
Which is?
Well, if something seemingly as basic as hospital water and drainage systems have had this kind of critical blind spot for decades, leading to these serious unaddressed risks, what other fundamental assumptions, things we take for granted, might we need to challenge? In our wider search for truly safe and healthy environments?